Hi everyone, Ashley here with New Life Cosmetics. Right now we're about to do a hormone pellet insertion on one of my male patients. A lot of you ask what the hormone pellet is actually for. I know a lot of men wonder about it as well. Every patient is different. That's why the consult is so important. But the hormone pellet is usually used for any type of muscle building. As we get older, our testosterone goes down. We need that muscle to be built up again, and testosterone plays a huge role in this. It actually also helps with sexual libido. It helps with energy. It helps with mental fog, mental clarity. It helps with a lot of portions of our actual function throughout the day. So now I'm going to go ahead and do the procedure, and on the next video we'll show how the procedure is actually done. Okay, right now we are numbing the area. It might sting a little, burn a little, just because of the medication we're using. So for men, on average, we use anywhere from 7 to 10 pellets, and that's completely normal for the male patient because their goal is much higher than we would need for a female patient. So of course, there's a specific way we need to numb them. We do want the goal for male patients to be anywhere from 600 to 800 on testosterone. Some men do like it a little higher, and we can always talk about that during our consultation. But as you can see, my patient's not making any noise. He's perfectly fine. He's perfectly comfortable. And after we numb, that is when we'll make our small incision and start inserting the pellets. So each patient, male or female, also gets a B12 injection. This just helps break down the hormone, helps it metabolize better as well. And of course, it also helps with your energy boost. So you will get a B12 injection with every hormone pellet insertion. You can see the patient's no longer feeling anything at this point because he's really well numbed. Next is we're just making a small insertion. So this is all we have to do for our patient. Again, no pain for him. And now we'll insert the pellets. So this is the device we use to insert the pellets. It's called a trocar. We've already inserted it into the patient. Again, you can hear that he is not having any pain. Just switching gloves now so we can keep it sterile. So a lot of patients ask us, well, how big are the pellets? They're about the size of a Tic Tac, not big at all. And we'll start our insertion. So for male patients, because they require so many pellets, we do have to fan them out. If you're not comfortable with this, we can always use both sides instead of just using one. That would mean though that we would require 2 different cuts, 1 to each side. So completely up to you. If I see that that's necessary for you, of course we can always talk about that. Go. So we have finished our pellet insertion. You can see it's a super small incision. It's not bleeding anymore. So usually afterwards, we just place some pressure. These are the strips we're gonna place over, so there's no sutures involved, nothing extensive. So right now, you're just gonna see me place these little strips over. These strips will be kept on for 3 days, and we just ask you to do no heavy lifting or heavy squatting because of course we want the pellets to really embed themselves and get comfy in there. And then afterwards, we just place a Band-Aid and you are done.